Setting up your first physical therapy appointment, we try to make it very simple. A lot of patients, when they call, they have questions about what to expect at their first visit, especially if you've never been to physical therapy before. So the first time you call, you are going to speak with one of our office managers, and they will take you through a pretty detailed intake process. So they'll ask you if you have your insurance card available, and we'll take your insurance ID down just to make things a little bit easier when you first come in for your appointment. They try to get you in as quickly as possible with one of our therapists at our 3 locations. And when you first come in for your appointment, we will walk you through a check-in process at the front desk. You will be greeted by the office manager who can assist you with this process. We use an iPad that is connected to our EMR system called Braintree. And at the first appointment, it's a little bit more detailed, so it'll take you through your insurance coverage if people have any questions about what physical therapy might cost per session. Everything is really laid out nicely, and you have full access to your insurance benefits, which is the nice part about why we ask people to have their insurance card ready during the initial intake process. The therapist will then take a copy of your insurance card and your license or some form of identification, and we do ask that patients bring those items when they come for their first appointment. Most of the time, if people do have more detailed questions about what to expect, such as what to wear for physical therapy, that is something that the office manager can answer during the initial phone call. And we just usually ask that patients wear something that's comfortable. And if they're coming in for, say, a shoulder or something maybe lower body like knee or ankle, wear comfortable, loose clothing that we can potentially roll up if we have to take a peek at that joint. Once the check-in process is complete, oftentimes we will use a system called Photo, which is a way for us to get some subjective measures of what the person is complaining about. So it's a nice form of questions basically about the body part that the person might be having issues with. Once that's done, the physical therapist will then bring the patient back into the clinic or into one of our private treatment rooms and perform an initial evaluation. Usually we start with what the patient had going on in the past and potentially some past medical history. If this can also be completed during the intake process, when the patient first schedules their initial appointment, they do get a welcome email sent to them, and they do have access to our patient portal, which they can go online and complete the full detailed past medical history form, and that can save us a little bit of time during our initial evaluation as well. But this gives us a really good idea of not only how the patient is presenting today, but things that they have dealt with in the past, maybe other injuries they might have had, surgeries, things like that that can truly affect how they're presenting today. We then jump into a little bit of objective findings. So the physical therapist will take the patients through a detailed physical assessment, and we try not to focus on the sole body part that the person might be complaining about. So say they're coming in for an ankle injury, we try to take a full body assessment because things can affect what's going on in the foot and ankle, up the chain or below. So we try to kind of look at the person as a whole and not to really focus solely on that one singular body part. Oftentimes when we evaluate somebody, things pop up that we might not be expecting. They might have another issue going on that wasn't really thought of when they first made their initial appointment. So it's really good to take that full 60 minutes and kind of dive deep into the patient's physical abilities. We do usually take them through range of motion measurements, strength measurements, but also some functional things like squatting, watching them walk and looking at their gait deficits and things like that, so that we understand not only how they might appear during an assessment on the table, but also how they're performing tasks throughout the day. Things tend to be different when you're doing things at home and doing kind of normal ADL daily activities than if we were to sit here and just look at your ability to raise your leg up toward the ceiling, for instance. Once the physical exam is over, or even sometimes during the exam, we try to sprinkle in some exercises and some education along the way as well. So we really get to know each other and establish good rapport, and it gives us the ability to also, as physical therapists, lay out kind of our expectations when it comes to physical therapy and sort of what we hope to achieve with the patient, but it also gives us an opportunity to take into account the patient's goals as well. We really pride ourselves on patients being involved in their care, and that sort of guides our establishment of our plan of care and our own goals with the patient as well. That's one thing that all of us as therapists ask is, what do you want to get back to doing? What are your personal goals? And we use those goals in helping us to establish the plan of care when it comes to PT. So during the initial assessment, we also add in some home exercises that they can start doing right away at home. Those exercises, keep doing those at home. We're going to start fresh and do newer things in the clinic to kind of progress you appropriately. After the initial assessment is completed, we will sort of lay out what to expect with PT. So whether that means returning once a week, twice a week, and sort of the idea of the duration that might be required depending on the person. Everybody is very different. Recovery looks different for everybody depending on the surgery or what they're coming in for. So we try not to be cookie cutter in describing, okay, you're gonna come in twice a week for 6 weeks. That might change. So we try to be as open and honest with patients during the initial assessment. We also revisit it. Every 30 days we do a progress note, and that involves looking back at our initial goals, figuring out, okay, what did you meet so far and what do we need to continue to work on, or maybe what are some new goals? You've met these, let's figure out, okay, we want to get you back to golfing, let's take that next step. We can't wait to see you for your first physical therapy appointment in one of our 3 convenient locations, and you can visit our website at birdphysicaltherapy.com for more information.